Hello, my healthy friends, or would-be healthy friends. I'm Dr. Murray Susser. I'm a Lyme-oriented doctor, and I've been involved with treating alternative medicine, including chronic fatigue syndrome, for about 40 years. I wrote a book with Dr. Michael Rosenbaum called Solving the Puzzle of Chronic Fatigue Syndrome, if I can get that on the screen for you. There it is. Solving the Puzzle of Chronic Fatigue Syndrome. The reason I bring that up when I'm talking about myalgia is that a lot of myalgia goes along with chronic fatigue. And the definition of chronic fatigue syndrome is I think, a silly definition, but I think it's better than the definition of fibromyalgia syndrome. Definition of chronic fatigue syndrome is greater than 50% debility for greater than 6 months with no known cause. That's the important feature of chronic fatigue syndrome. Chronic fatigue syndrome, I think, is usually caused by a hidden infection, and I'm kind of a drudge in that regard, because I think fibromyalgia syndrome is caused by a hidden infection most of the time, or hidden toxicity. And fibromyalgia is a disease of pain. It's a syndrome whereby people have pain generally over most or all of the body. It's not usually a localized pain. That wouldn't be called fibromyalgia usually. That would be called a localized myalgia. Myalgia is myo is muscle and algia is pain. And fibro is scarring or scar tissue. So fibromyalgia syndrome is defined as a condition with chronic intense pain, very resistant to treatment, and diagnosed by approaching 11 of the 18 trigger points that are specified around the body. There are trigger points on the head, on the neck, and the back of the shoulder, and several places in the shoulder, one in the chest, one in the down here in the ribs, and one, I think, in the knee, and there's 9 on each side of the body. Therefore, there's 18. And when you have 11 of these 18 trigger points positive to pressure, that means they're painful when you put any kind of pressure on them, then you're defined as fibromyalgia. That's 11 out of 18. I don't know what it is if you have 10 out of 18. I certainly don't want to know what it is if you have 9 out of 18. But you could have the same kind of pain and debility as you do with 11. So I think the diagnosis borders on ridiculous. But it is a diagnosis, at least it's something to start your conversation from. And the conversation, I think, should be about hidden causes. Fibromyalgia has no pathognomonic test. What does that mean? Pathognomonic means patho is disease, mnemonic has to do with naming it. So there's no test that names the disease with certainty.